Hi, everybody. If you have been following the conversation around Black maternal health, you probably already know that RFK Jr. had a clash with Representative Summer Lee, and she really grilled him, and rightfully so. Especially if you are familiar with this topic, you know how serious this topic is. And RFK Jr. is so deeply unserious about his job and his role at Health and Human Services, HHS. I've come to really understand that his primary role is just to serve the political agenda of Donald Trump. So I am not surprised by this exchange that RFK Jr. had with Representative Summer Lee, and we are going to watch that video. So before we continue, we're going to dive in shortly, but I'm Kiko Akialoha. If you're new here, I talk about deconstructing colonization, decolonization, all of the fun things around that. Usually I'm talking about it in context of Hawaii, but my background is in public health, which is why I am talking about this issue, especially because public health is all about identifying disparity to close gaps. So anyway, without further ado, let's watch, and I'm going to talk you through some of the bigger pieces of this, at least from a public health angle. Yeah.
Black Maternal Health Week, so I'll just start there. Secretary Kennedy, I'm sure you're aware that Black women are at least 3 times more likely to die from pregnancy-related causes than white women. The vast majority of those deaths are preventable. Black women in my district are more likely to die during pregnancy than their peers in 97% of U.S. cities. Your written testimony mentions maternal and child health 4 times, but from what I've seen, the NIH canceled grants researching Black maternal health. Your administration's fiscal year 27 budget proposes eliminating Healthy Start, which is one of the federal government's primary community-based maternal health programs. And you've made it a priority of HHS to end diversity, equity, and inclusion. So yes or no, my question for you is, if a medical school or a public health school educates students about addressing the Black maternal mortality crisis, would you consider that an illegal DEI?
No. I'm so glad that she's asking this question. What she's doing is talking about a number of words, a list of words that went out to different organizations, universities, health institutions that have contracts with the federal government under HHS and agencies like HRSA, the NIH, the CDC, and they created this list of words that are basically trigger words, searching everybody's different grant proposals, their contracts, the services that they were going to provide, the type of research they were conducting, looking specifically at those words. There were people who decided to yank funding if they identified just a number of these trigger words, which is why it's been so controversial. It's a really bad way to do business. It's a really terrible way to carry out an agenda because it's not evaluating the quality of the work that's being done. It's literally looking at a single word and making a decision based entirely off of that. Now, as somebody who works in HIV care, a number of the words that are relevant to our work are on that list. Things like harm reduction or LGBT, gay, gender, transgender, things that are related to HIV risks. So we're talking about sexual health, sexual orientation, sexual identity. These particular words were meant to shock people. They have shock value. And that is why it spread like wildfire when this first started happening a little bit over a year ago. So anyway, Representative Lee is bringing this up because these words that she's talking about, this list of words, they're all considered part of a larger DEI scheme that this administration is manufacturing a problem around. There's not a real issue around it. It's not about DEI. It's about just carrying out a specific political agenda. They're not wrapping up research that is truly like wrong. They're not actually attacking programs that are problematic. They are attacking things that don't align with their political goals. And in research, that in and of itself is problematic because you're trying to wash out all of the information that you don't agree with and don't like to see. But that's not what the scientific process is, and that's just not reality. So anyway, I'm very grateful that Representative Lee brought this up. So let's go back to the video.
No, you would not?
No.
Great. I do hope for the medical schools, the universities, and the accreditors, your administration has been threatening that they're watching this and take this directive to continue teaching about and addressing the Black maternal mortality crisis. And I expect your agency to restore and expand funding and support for that work. Also, yes or no, do you think consuming more protein and avoiding Tylenol will prevent Black women from dying 3 times more likely during a pregnancy?
I doubt it. Tylenol doesn't.
I just have to say it's really funny how RFK Jr. is backing away from this conversation about Tylenol like he's being asked something ridiculous. And yet he has been talking about Tylenol like an insane person for many months since he was confirmed as HHS secretary. So I don't think it's too far outside the realm of reasonableness to ask him these wild questions about Tylenol.
So then why aren't you putting forth serious policies that actually address the health crises in this country instead of just these unserious conspiracy theories and this wellness influencer mess that we.
Do you want me to answer that question, or are you just talking?
No, it's a question.
I'm glad that she brought up wellness influencers, by the way, because wellness influencers, oh God, there's so many of them who talk about science in a misleading way, talk about health in a misleading way, also that they can sell products. And it's not products that are proven to work, it's products that they manipulate their audience into believing is going to be helpful without any proof of that. And the way that they achieve that goal is by undermining scientific research, by really kind of glossing over the fundamental parts of it that need to be understood and shared. They cherry pick information. They don't share complete information. Anyway, I am glad that Representative Lee is calling out wellness influencers because they have become so problematic.
You're doing more on maternal health than any other administration.
No, I said Black maternal health.
On maternal health.
Black maternal health.
That includes blacks and whites.
But the thing is that they're actually not the same outcomes, which means that we need specific and intentional interventions for Black maternal health and Black infant.
Can I finish? I'm saying.
Are you going to answer that?
Yeah, we have right now, we've implemented a perinatal pilot project that we're in 220 hospitals around the country. And we have reduced maternal health mortalities by 42% at those hospitals by providing them protocols.
Can you please share what the reduction has been for Black maternal health?
Across the board, it's 42%.
But Black maternal health still has worse outcomes than other people.
I wouldn't know. It helps everybody.
But it is.
Oh, he's so smug right there. It drives me crazy. So RFK Jr. is talking about maternal health and Black women's, or excuse me, he's talking about maternal mortality coming down just across the board, which is true, except there is one group of people whose mortality has increased. And can you guess which group of people that is? It's Black women. So when he talks about this intervention that HHS under him is carrying out, that it's helping everybody, that's not true. It's only helping people who help to raise whatever metrics they're using to define success in this way. And it's really easy to make it seem like you're making improvements when you're only focusing on the people that you can actually effectively like roll out an intervention with. So if your intervention depends on working with people in hospitals, that means the people who are coming need to have access to the hospital. Very often they need to have insurance too, unless they're going in through an emergency room. And that access is a huge deal because not everybody does give birth at a hospital, even in 2026. You know, there are people who do traditional home births. There are people who just don't have a ride to the hospital, and that is more common than one would think. So when you talk about people being helped because you've rolled out this intervention in hospitals, what you're not mentioning is that you're still missing the people who don't have access to hospitals.
Is it?
Object to that?
Okay, thank you. It is not. I do want to just for the record, state that. It does not help everyone. Your agency told programs to remove a list of nearly 200 words and phrases from their funding applications, including the word Black. Do you have an idea of how we could solve the Black maternal mortality crisis if we can't say Black?
President Trump is trying to end division in this country, not sow division.
Not eviction.
This is their narrative, that by acknowledging racial differences, people are sowing division. But the reality of health in this country, of public health, is that real disparities exist for communities of color. And not just for Black folks, but for Kanaka here in Hawaii, for the Latin community, for Native Americans, Alaska Natives, American Indians, also experience significant disparity. And what Representative Lee is asking about is, how do we address the problems in these communities if we can't name these communities? Because if you can't name the community, you can't tailor an intervention to it. So RFK Jr. here is pivoting immediately to DEI and talking about how problematic DEI is, but this is a cop-out. They talk about DEI as a means to deflect from their inability to actually correct the disparity that their initiatives and their interventions are actually creating. So, yeah.
During the last 4 years, that's what DEI did. It divided people. It polarized people.
No.
And that's just false. DEI didn't polarize people. There are people who made it into a problem, but it is a manufactured problem. It's not a real problem. The people who had privilege and then lost privilege, who interpret themselves as having been marginalized, are the ones who manufactured this problem.
No. We're not talking about eviction. We're talking about healthcare.
I'm calling about DEI.
We're talking about healthcare.
Yeah.
Disparities. So what we're asking is if you attack DE&I and then we have a crisis that impacts one population over another, but you cannot direct specific spending or research or interventions to that population, how do you solve the problem?
Do you think the federal government should be paying for DEI?
I think the federal government has a vested interest in ensuring that its citizens survive childbirth.
Well,
that was a fabulous retort. I am so grateful for that, because the way that RFK Jr. and, well, everybody in the administration, but the way that he's pivoting to DEI here as a means to avoid accountability for disparity and addressing disparity, which is the role of public health, I'm glad that she wouldn't let him get away with that bullshit.
we are meeting that obligation.
We are not.
Oh, that I can explain to you how we are.
You have not done so far.
Yep, and she's right. He has not met that obligation. This is kind of just, it's a drop in the bucket with RFK Jr. and all of his nonsense. This is just his MO. This is how he operates. And he continues to lie about public health. His HHS continues to direct funding away from the communities that actually need it, all because they're politicizing the issues that people are working with, which is why people working under SAMHSA had to do complete overhauls of their programs to weed out certain words that the federal government is super offended by. It's a mess. I remain grateful for Representative Summer Lee. I think that she did fabulous. I'm really glad that she brought this up with him and keeps hammering away about Black women's maternal mortality, because Black women's maternal mortality there is so much disparity there. Black women are 3 times as likely to die during childbirth than their white counterparts. And this disparity exists not because the women themselves are more vulnerable on a physiological level. It all has to do with access. It has to do with income, has to do with where they live. These are all social determinants of health, and these are the things that drive disparity. Anyway, thank you for making it to the end. I hope that you are all doing well. Don't forget to like and subscribe, and also follow me on Instagram, TikTok, go all of the places. I hope that you are all doing well. All right. Ahui ho kako. Aloha.